Christian parenting. Hey friends, welcome back to the podcast. I'm so glad to get to hang out with you today. And wow, I am excited to be entering a new month where we get to talk all things women's wellness. We had a month of women's wellness last September. If you missed that, definitely go back, check it out. We covered a lot of really good stuff and had a ton of fun. And we've been waiting and kind of saving up some of these topics that I'm so excited about. But today we are kicking it all off with a conversation with Dr. Anna Cabeca, the girlfriend doctor, who is a triple board certified OB gynecologist. And we're talking all things hormones, perimenopause, menopause. She even speaks to those of you who have daughters in the, teenage, young adult years. We cover a lot. And I think, when it comes to topics like this, there's a lot of opinions out there. And even among experts, there's many ways to approach these kinds of things. And we will agree, even in this conversation, that our medical world is really behind in the area of women's health and hormones. And it's so good to see more conversations coming up more recently, more research being done. I think we have great news that there's just going to be more and more information ahead. But with that, how we approach things is going to vary. And so Dr. Anna is probably going to be somebody that many of you resonate with. She takes a really holistic approach to hormones. She talks a lot about different blood work you can get done, so you might want to take some notes if that's something you're interested in. She's talks about a keto-green diet. So again, some of you are going to really resonate with that. If you have a different way of approaching these things, I still think you're going to learn a lot. I know I did. Some of the things that I haven't even thought about, I was like, okay, this is good for me to ponder. New information is always good. And of course, if it's not relevant to you now, it might be later, or maybe you know someone who would benefit from the information. So one thing I know is that Dr. Anna has an amazing story, and I think you're going to just enjoy getting to know her and hearing more of her story. And of course, there will be links to everything we talk about and all the things she has to offer. There's a lot. You can find all of that at monicaswanson.com/girlfriend-doctor. Okay, guys, without further ado, let's jump in and have this conversation with Dr. Anna. I'll have a few final words to say at the end, but I hope you are encouraged. Dr. Anna, so excited to talk to you. Welcome to the podcast.
It is great to be here with you, Monica. Thank you for having me.
Yes, well, your voice is very familiar to me. I've listened to a lot of your podcast episodes, and there's so much I want to tackle. I feel like I could keep you a long time, so I'm not going to waste any time. I want to hop right in. But before I do, could you give a brief introduction to who you are, what you do, and all that kind of stuff?
Yeah, thank you. So I'm a mom of 4 daughters. I had a son. I have a son too. My son passed away when he was a wee toddler. And so I could think of you, Monica, with 4 boys. I have the 4 girls that I've been blessed to raise. I've got horses here in Dallas, Texas. And I am a trained OBGYN. I trained at Emory University. And then I went on to realize that my doctor bag was insufficient to help me or my patients. And so that led me literally on a journey around the world, and 2 additional board certifications, one in integrative medicine and one in anti-aging and regenerative medicine. And, and I just kept digging in. I really work to empower women through education, inspiration, and a little bit of an entertainment too. So really just try to here to empower and to help and to serve, and created products and programs and solutions. Because so much, really honestly, so much of what creates health and longevity and quality life is within our nutrition and lifestyle. I mean, that is 99% of it, if I'm to be honest.
Yeah, I love that. And I told you before we hit record that my husband is a tough audience. And so when I first discovered your podcast and started listening, sometimes he's a little skeptical. So I was like, okay, you have to listen to one episode. And people who listen regularly know Dr. Dave, and he listened to you and he's like, okay, she's really smart. So that was my test you had to pass. But yes, I really love your journey. In fact, before we go on, can you tell a little bit more about what you did when you kind of took some time off of your regular job and went around the world? What did that look like?
Oh my gosh. So it was homeschooling. You're a homeschool mom. I never aspired to homeschool, but part of my post-traumatic growth experience was this, to keep the earth moving under my feet, essentially. So travel has always been like a meditation to me. I love to meet people. I have family around the world, and I just, I just serendipitously left. But to be honest, it was God's hand in it every step of the way. I met people from Native American shamans to Andean philosophers to learn and experience indigenous foods in Peru and in Argentina and a rainforest. And and then in Australia and Asia and the Middle East. And it was serendipitously, I met the most amazing people. And through that journey, because prior, and this is in 2006, I was diagnosed with infertility and then early menopause post-traumatically, again, because we had lost our son. And then I failed 6 rounds of infertility treatment of the highest doses of injectables, then diagnosed with early menopause. And, as an OBGYN, I'm like, okay, well, that diagnosis at age 38, 39 is not reversible. I mean,
Wow.
it's irreversible in general, but it was, and I didn't even have that in my mind that this is something that could happen. But as a result of this and the people and the practices and the medicinals that God put in my path, reversed early menopause, then naturally conceived the child I was told I would never be able to have. And so at 41, and so her name is Ava Marie, for the Blessed Mother, and she is seriously a miracle child, and hence the horses and the dogs in Texas, to be honest.
So great. Oh, they do that to you, right? I love it. So you had her at 41 and then re-entered menopause years later, is that right?
Yeah, well, officially went through menopause at age 56. At age 48, I was having full-blown perimenopause again. And I was like, whoa, one period in 6 months, and then mood swings, irritability, brain fog, sleeplessness, because I also still had the underlying PTSD that I hadn't really grasped. And that's in 2014, 2015, around 2014, it was hitting its head. And that's when I realized, okay, I've got to pick myself up, First thing, I focused on getting into ketosis, getting alkaline, combining those two practices, which I call getting keto-green. It's nutrition and lifestyle practices. But, and checking urine pH, that is one thing, and I think as physicians, it's on when we did urine dipsticks way back before it was all automated, checking urine pH was one of the easiest things that, we did. We looked at white blood cells, blood, ketones, but pretty much we ignored the pH. And it was on there for a reason, because an acidic urine pH, I mean, as a gynecologist, that's eating away the bladder wall, first of all. Wow. But it also is a sign of stress, because cortisol increases acidity, and we see that in the urine. And so when I started getting into ketosis, because at 48, I started gaining, I gained 20 pounds without doing anything different overnight. So I was like, I'm cutting out the carbs. I'm going to eat, keto for, in a healthy, relatively healthy way. But I checked my urine pH, and I was as acidic as the pH paper read. Wow. So for me, it was a huge aha moment. It means I'm breaking muscle, I'm breaking bone. No wonder I'm feeling crazy and less tolerant. That's a nice way to say a moody witch. But, at that point, I was a single mom, raising these girls, and it was, I had to figure out what to do. So I focused on alkalinity. And where my faith came into practice is one of the things that if I'm having a difficult time, fast and pray, right? We're taught that, fast and pray. And so as it occurred to me as I'm doing extended fasting, et cetera, and focusing on alkalinity, and I'm checking urine pH throughout the day, that the days I did my gratitude journaling and my prayer meditation first thing in the morning, I was more alkaline all day.
Wow.
And that's the gift of gratitude, gift of prayer, gift of oxytocin. Oxytocin is alkaline. Cortisol is acidic. And having that, empowering oxytocin is singularly the most powerful thing we can do in health, in my opinion.
Incredible. I love that. That is super cool to think about. And I'm kind of tempted to just keep going right down into talking more about that. But before we do, I think I might back up a little bit and ask you to do a little bit of Hormone 101 for us. Since I haven't talked much on the podcast about this stuff, I know I've got people listening who still have little babies, or maybe they're just pregnant. So do you mind just giving us a little foundation before we get to perimenopause and menopause about what's going on hormonally in women with our estrogen levels? I know puberty is when they all like go up, right? And then as far as I understand, and I'm not an expert in this, and one side note here, and I know you agree with this, my husband went to medical school and residency. Yes, he's a hospital physician, not an OB-GYN, but I don't think he learned much about women's health in this area. So I hope that that's something that will be improved in the years to come. But with that, we're all just learning right now, right? So can you give us a little education on what's going on with hormones throughout those years of motherhood until we hit peri and menopause?
Yes. And I would say to anyone listening, and especially those with daughters, sons, with children, is that it's never too early to start balancing hormones. It's never too early. And it starts from ancient wisdom. As I traveled around the world and as I've continued to study international medicine, like when we have hormonal issues like traditional Chinese medicine, back to the Egyptian and Arabian first physicians in Ayurvedic medicine. It's all detox the liver, detox the kidneys, fasting. I mean, it all comes into play when in these, and in modern medicine, we never talked about any of that. I mean, I was physiology. I worked in physiology before I went to medical school.
Wow.
And so it was like, we didn't talk about any of that for
Right.
hormone balancing. And so that's critical. So detoxing, decreasing hormone disruptors, keeping our liver healthy and happy makes a huge difference. So I have a 16-year-old daughter at home. She's my fourth daughter. I'm like, I've got to make sure she's very hormonally balanced because again, like I have no more tolerance.
Yes.
So it's things like making sure she's getting greens and not having high fructose corn syrup and doing the best we can with fast food when she's off driving with her friends and everything else, and really imparting, okay, here, I have her do my mighty maca, especially when she's nearing her period and I can tell and she can't.
Right.
I'm like, okay, let's mix you something. Let's make you a smoothie, honey. So that's, one time she said to me, she said, Mom, all my friends have problems with their period, and it's crazy, like heavy bleeding, pain, all this stuff. She goes, I don't even know when it's coming. And I'm like,
wow. You're like, you're welcome.
Yeah, you're welcome. I'm like, but I can tell.
Wow.
And I like nip it in the bud. But no, mostly she's really, really balanced. And I just love that was her awareness. And so that's like in our teens, no dairy, no sugar, really work on the greens, healthy protein and hydration, electrolytes. That's really important. Wow. And then in our 30s for optimizing fertility, it's the same thing. What works for a menopausal woman works tenfold faster for a reproductive age woman. So like I tell them, I put them on my keto-greens 16, my second book. My first book is really amazing. Really, it's my foundational. It's called The Hormone Fix. And my second book is a very short, easy 16-day plan called keto-greens 16. And that's great to, support. And all the menus are medicinal menus. So really work to use herbs, spices, and, fermented foods, et cetera, to support phase 1 and phase 2 of hormone detoxification. So doing it through food and some intermittent fasting, that in a healthy, very healthy way. So in our 30s, working on that keto-green approach, I mean, it just is game changing. I had I'm talking too much, but I tell you a patient story about.
Please do. Tell a patient story.
Yeah, this young, lovely 32-year-old. She'd been diagnosed with infertility and PCOS, and she'd had like 3 periods in the last 12 months. So very irregular breakouts, acne, hirsutism, facial hair, weight gain, and difficulty losing weight. And, and she was miserable. So she came in to see me and I said, follow my keto-green 16 plan. I recommend she start my Mighty Maca supplement, which is a 30 superfood combination, which honestly, that's from my healing journey. Those foods I experienced around when I traveled around the world. So I wanted to bring them back to me for me and my patients when I came back into practice in 2007. And so anyway, so it's like a foundational. So I put her on that and had her follow keto-greens 16, no dairy, no gluten, very low glycemic, which is really ideal for our clients with polycystic ovarian syndrome, plus to support detoxification. Extra supplements were vitamin C and a multivitamin with minerals. And I had her hydrate really well between meals and use electrolytes once or twice during the day too. And get out, I will say, get out in nature, try to at least get a sunrise or a sunset every day. And she came back in 2 months later. She'd had a period and she was on her second one. So in like after 3 periods in like 12 prior months, she had back-to-back periods. She'd lost 30 pounds in 2 months.
Incredible.
And she was just feeling so empowered, right? There was no spironolactone, no birth control pills. I'm not writing that. I'm like, let's work. And when she understood that she had the genetic, these are, I say tribal genetics, Amazonian genetics, whatever, Mulan genetics, Pocahontas genetics. I mean, for PCOS, those are some powerful genetics. So we do better in this kind of low glycemic environment. And when she felt empowered, it completely changed her mindset, her confidence level, and she was incredibly disciplined about it. So
wow.
It was really beautiful to see.
Well, what I appreciate about that is you're saying that we're not at the mercy of our hormones. It's not like we have to, in fact, what is your quote? I have heard you say many times, menopause is mandatory, suffering is optional.
Sure.
But the same applies to all of those PMS symptoms, all of the years of fertility. You're saying there's a lot we can do.
There's a lot.
And my husband's way of saying that is because he deals with a lot of end of life situations. He says, he's dealing with a lot of diseases of choice, where if you know enough, if you are educated, there's a lot you can do to live a healthier life and a longer life, feeling good throughout all of the years. So that's incredible that you really believe there's things we can do just through the food we eat and the supplements we take to feel better throughout all of those years. But what about, let's then jump to what happens when we hit perimenopause. In fact, tell us what perimenopause is. What are the first signs that we are entering perimenopause?
Yeah. And so when we think of our hormones, we think these are chemical messengers, but they're also energetic messengers. So they change, they interact, they fluctuate. But in our life, we have our menstrual cycles, so they fluctuate on a monthly basis. And as we get closer to perimenopause, we're losing not producing as much progesterone and DHEA. Those are the 2 first hormones, DHEA and progesterone, that start to decline. And we need progesterone to have a regular, menstrual cycle. We need that progesterone. It's predominantly produced by the corpus luteum. So after ovulation, our ovary produces a corpus luteum, and that produces the majority of progesterone until if we become pregnant, then the placenta takes over and that progesterone maintains the pregnancy. So it's really important. But you'll hear terms like in perimenopause, people complaining of estrogen dominant symptoms, which is like PMS, mood swings, irritability, brain fog, weight gain. But really, it's progesterone insufficiency. Okay. More so, progesterone insufficiency. And what I've seen from incorporating, traditional world views of medicine and detoxing, you need liver support. You need detoxification. Like a car needs an oil change and filter change, right?
Right.
Like you change that. For us, it's giving the liver support and kidneys and making sure we're having regular bowel movements is key to hormone balance. And so as progesterone starts to decline, we have to work on our adrenal glands to produce more of its hormones. So more progesterone from the adrenals will produce progesterone and DHEA. But if you're under stress, and this, certainly has happened in my life, work stress, family stress, teen stress, world stress. I mean,
there's
name
a lot
it,
of it,
right?
Yes.
And you're going through perimenopause or menopause, your kids are going through puberty and there's elections going on. It's like, wait, there's hormonal havoc here because cortisol, and I mentioned earlier that cortisol and oxytocin oppose each other, but we need cortisol. It's a potent anti-inflammatory. It's a steroid hormone. It's
Okay.
anti-inflammatory, but it's made from progesterone. So we will sacrifice reproductive levels of progesterone to make life-saving, and sometimes not, levels of cortisol.
Okay.
So we make this cortisol and it empties our progesterone buckets even more. So if you have a stressful time and your periods are irregular or you have more PMS, it's often because of this progesterone insufficiency. Or
Interesting.
yeah.
Okay.
Yeah.
So, what are some of the signs? What if somebody's say even upper 30s? When would perimenopause typically begin?
So honestly, with the hormone changes, when we look at ovarian function in our mid 30s, we start to
Wow.
have a decline in ovarian function.
Wow.
And so many people don't even realize
That
they're
was me.
symptomatic
Hmm.
during that time until many years later.
Right.
But those symptoms can be in mid 30s, typically mid 40s. By mid 40s, you're experiencing those symptoms, including the brain fog, memory loss,
Right.
anxiety, sometimes mood swings. So,
Right.
and this is how we know because in our medical system, in between age 45 and 50, or 45 and 50, there's an increase in SSRIs and
That's right.
sleep meds and so anti-anxiety medications, antidepressant medications during this time because hormones affect our neurotransmitters and they really work together with our neurotransmitters.
Right.
So women get these diagnoses like bipolar or PMS or anxiety or depression, and they're really, you know, need hormonal balance. Need,
Absolutely.
yeah.
Yes. Well, I think most of the conversations I've had with friends, who don't really know, none of us know anything. I feel like we all hit this stage and we're like, wait, how come we didn't learn this earlier? But so many people assume that perimenopause is literally the year or two before you quit having your period. But it really can be an extended period of time, right?
It really
Like
can be.
10 years or more even because I'm now 54 and just now 6 months out from my last period. But I think back and I'm like, goodness, for the last 10 years, my sleep has been disrupted. I got frozen shoulder at age 49, and I didn't put any of that together with hormones. So now I'm just like, my eyes are being opened to all these things.
Yeah, yeah, and I experienced a frozen shoulder a couple years ago, and it like sets you back. It's like
Oh my
I
goodness.
thought, oh my gosh, I want like now I understood why some I always say old lady bras, you
Uh-huh.
would buckle in the front, and I'm
Yep.
like I had to do a lot of work, but definitely I'm going to send you my balance cream and put it on your shoulder too. I mean, it's good for everything, but
Mm,
using it on your shoulder because the fascia has hormone receptors in it,
okay.
and that can really
Oh.
help too. But
Yeah,
you
I
know,
mean, I've felt like starting a support group for people with frozen shoulder because I had no idea until I got it. And the sad thing was, I got it for a good 18 months in the right shoulder. And as soon as it was gone, the left shoulder
oh
started. And I was
no.
like, no. But I didn't realize that there was a hormonal component to that and so many other things. So, are these things happening because of that drop in estrogen? Am I understanding that right?
It really starts with the drop in progesterone and
It
DHEA.
does.
And
Okay.
those are more of the pro-androgen hormones. And
Okay.
then estrogen receptors in the fascia. And
Okay.
that's why, again, estrogen receptors and androgen receptors, so androgen being like testosterone,
Yeah.
they're receptors in the vagina. So it's like we're not treating it. Every one of us will get thinned out, less flexible, drier vaginal tissues and in bladder issues, and it's just very unpleasant. So
Yes.
using hormones in these areas topically is so powerful. Is so powerful
Okay.
to reverse those changes. But all the fascia throughout our body has
Right.
hormone receptors.
Isn't that interesting? They're all related. Like, and most of us wouldn't even put that together. We would just say, oh, I had frozen shoulder. Now I have, dryness. We have all these separate issues, but they're
Or
all
joint pain.
joint pain.
I had a patient in my office yesterday. She goes, it's harder to put her rings on now, getting it over her knuckle. She's, I've always been a size 4 ring, and now I can't get it over my knuckle. I had to go up to a size 5.
Interesting.
And it's like, that's like micro inflammation.
Okay.
That's,
Wow.
those are things, those are symptoms. Our body is telling us something.
We're not crazy.
Not crazy. And we don't need an antidepressant. We don't need Xanax.
Well, one thing I've said is that I wonder if they've ever done a study, and this is, again, could be a much bigger discussion, but how many people do go through divorce that
Totally.
they say, oh, we had an empty nest, we grew apart, we realized we were so different. And I'm like, and you are probably in the middle of some serious hormonal craziness.
Totally.
And like, should we keep that in mind when we're, in fact, I love what you say about your partner and how you feel about them. Go ahead and say it, because it's better coming from you. Something about if you...
Yeah, if you only hate your partner 2 weeks out of the month, it's probably your hormones and not necessarily your partner.
Isn't that
it's so true.
Oh my gosh, Monica. Think about that.
I got to tell you a story. So I have a good friend of mine. She's a neurologist, and we were walking. Whenever I'm in Georgia, or when I was living in Georgia, we would walk on the beach and we'd go for a jog or a walk. And I noticed, she goes, she would complain more about her husband during a certain time of the month. And I was like, wait a second, I'm seeing a pattern here. Where is your menstrual period? I'm a gynecologist, right? I can ask these questions. Yep. When's your period starting? And she's like, it should be here any day now. I'm like, So I was like, okay, girl, you've got to buy into my program now. You've got to do it.
Hey friends, well, since I have been talking about diveintomath.com for math and science curriculum for homeschoolers, I have heard from so many of you who have taken the leap and started using Dive curriculum, and your kids love it. I am so excited to hear that, because my boys have also loved Dive for both math and science through the AP level. Now, if you haven't chosen a homeschool curriculum yet for math or science, or you're ready to switch it up, I encourage you to check out what our friend Dr. Shorman has to offer over at diveintomath.com. Dr. Shorman offers a biblical and historical foundation for both math and science, and he teaches the why of learning math, which makes a world of difference. Shorman Math is self-paced with state-of-the-art e-learning systems featuring expert video instruction, interactive assignments with auto-grading and grade recording, video solutions, and Q&A support with Dr. Shorman. My boys loved that they learned everything they needed without extra fluff, and they liked the 4-day school weeks as well. So head over to diveintomath.com, check out everything they have to offer. Okay, well, before we end here, I'm going to have you point people to all your different great products and programs. But I know that some people are listening and wondering, when should we talk to our own doctor, practitioner, see maybe a specialist? What's a sign that we need to explore more, maybe get blood work done? Yeah. What are your recommendations there?
Yeah, I definitely think that sometimes we don't just need one person, we need a team. We need a good health coach / life coach, nutritionist type person who has an integrative or functional background. We need to, have a good doctor that is familiar with customizing hormone therapy for when it's necessary and optimizing it in a healthy way. So I know very great physicians that are in clinics where they just prescribe hormones, but do none of the detox and the nutrition, the lifestyle aspects. And that's critical for long-time health. That's critical because it takes more than hormones to fix our hormones. Right. And asking the question. So I typically tell clients, especially in the mid 40s to 50s, hormonal integration, definitely adaptogens, definitely nutrition and lifestyle, really prioritizing sleep and oxytocin. So our prayer practices, our gratitude practices, constantly bringing gratitude into the present moment. What is it? Philippians 4, right? Verse 11. Yeah. Okay. So it is that is critical, continuing to focus on what is good. It's really So good, so much good science to back that up. And so
Yes.
focusing on that is really powerful medicine. And then hormones, I say often consult with a compounding pharmacy. That's a good compounding pharmacy in your area, and say who's doing hormones right, who's really working with, integrative therapies, is cutting edge, is safe, is not too high or too low, is using progesterone, even if you've had a hysterectomy. I mean, there's some basics here that
Okay.
I'm like, I still can't believe I have to say that. It's like, oh my gosh, with or without a uterus, you need bioidentical progesterone. It's good for the brain. I mean,
Okay.
probably low, insufficient levels was probably one of the reasons the hysterectomy was needed to begin with. I mean,
Wow.
so there's a
Really?
lot here. Yes,
Okay, so
there's
you're
a lot
saying we could
here.
actually reach out to a pharmacy. That's something you'd recommend? Oh,
Yep,
that's
to ask them who
interesting.
is a physician they've worked with. That I found that in working with women, in my virtual programs, that's been a great way for them to get a good physician. And then everyone, make sure you get, I don't care how old you are, if you've had a hysterectomy, get a pap smear. Get a pap smear at least every 2 to 3 years. Even if you're 70 years old, like, I mean,
Okay.
it's like people
Okay.
forget post-menopause to get pelvic exams,
Mhm.
GYN exams. And even if they're under, I've seen this over and over again, getting hormones virtually or at hormone clinics, and they're not getting an exam, pap
Right.
smear, physical exam, breast exam. The body's always telling us something.
Yes.
And yeah,
Good. I'm
so
a big
just that
believer in that.
emphasize.
I'm like, as long as I have health insurance, I'm going to take advantage of every, I'm just going to go to all the doctors.
Get all
I'd
the get
rather,
an
I want to
ultrasound.
know.
Yeah.
Yes. Okay. So what about blood work? Because I have heard mixed reviews on how important or helpful or not helpful blood work is when it comes
Yeah.
to hormones.
What gets, I mean, I say test, don't guess, and what gets measured gets managed. In my first book, The Hormone Fix, I'm going to pull it out but, oh, no.
I have
My
that
book,
one.
The Hormone Fix, it is, in chapter 2, it's all about testing. And in my online program, Magic Menopause, I have a whole module on testing and to really help you understand optimal versus normal. Optimal
Okay.
versus normal. I have a real famous doctor that came to see me. She's in a different specialty. She's in a psychology, psychiatry specialty. So, she's still a doctor. Okay, no, so.
Right. Right.
But so, and she was on hormones, but like I said, well, I've got to do these labs because these are other labs for longevity and looking at hormone levels and hormone detoxification. And there were so many abnormalities. I'm like, you're setting yourself up for
Yeah.
dementia. You're setting yourself up for mental illness. You're setting yourself up for heart disease. We have to
Wow.
address these. And so much is like your husband said, like, a disease of choice.
Hmm.
But once we know, we
Yeah.
can manage and
Right.
optimize. And I think testing is very, very important.
Okay, because you don't know what you don't know. And then later you're like, darn, I wish I had tapped into that. So could you list for us, or is there a specific panel that you would say, oh, just make sure to get this particular panel? What do we want to ask for when it comes to blood work?
Yeah. So really there's my panel is listed at, you go to ultralabtest.com/Dr. Anna Cabeca. So /Dr. Anna Cabeca,
Hmm.
and go down the page and to the left, you'll see my
Okay.
elite VIP panel. That's what
Okay.
I get on my concierge patients, on my private
Wow.
patients. And it
Okay.
has your fractionated cholesterol, it has a homocysteine, inflammatory markers, has your FSH, LH, estradiol, progesterone, testosterone free and total, pregnenolone, which hardly ever gets measured, red blood cell, magnesium, has your hemoglobin A1C and insulin levels. So really good markers in that test.
Wow.
And that you can print that out and take it to your doctor and say, I want these testing. And for the
Okay.
most part, insurance will cover it.
Really?
Or, yeah, for the most part, insurance will cover it. The
Okay.
thing with lab testing for hormones, though, if you're cycling, you want baseline labs, like especially the FSH, LH, and estradiol on cycle day 2, and you want cycle day 21 progesterone levels. Oh, yeah. And then don't forget the full complete thyroid panel with thyroid antibodies. And I
Right.
list those out in my book too. So
Okay.
it is that complete, very comprehensive. And you don't have to repeat that one, but you can repeat the problem areas, 3 months, 6 months, every 3 to 6 months till you get those optimized.
Okay.
But it gives you such a good perspective.
Right. I guess my husband has suggested, and again, this is not his specialty, but he says, throughout the month, your hormones are changing so much that it's really hard to get one test and have really reliable information. Is that how you
That
would
is
say it?
very true. And
Yeah.
that's why when you repeat testing, you have to do it the same time of your cycle, same time of day, and
Okay.
always, and ideally before exercise or activity. So, because after a workout, you'll have higher levels of testosterone.
Right.
So you try to do it in the same circumstances as you did before. But now the exception is when we're looking at baseline, estrogen, that's why we do it on cycle day 2 or 3. So
Okay.
that should be, our baseline. And for
Right.
FSH and LH, which tells us how much the pituitary is having to work to stimulate the ovaries to produce estrogen. So you
Okay.
have to look at that with an estrogen level. And then on day 21, looking at your progesterone, I do a lot of urinary hormone testing. So Dutch test or HUMAP or
Hmm.
Meridian Valley, all these different labs do urinary hormones, and they look over a course of a day.
That's right.
And the Dutch test can also do cycle mapping. So you're doing testing every day for 30 days or, from
Okay.
between periods to see what's going on. Another thing is
Interesting.
just checking basal body temperature throughout at the beginning
Right.
before you get out of bed and just like, we checked it if we were trying to get pregnant and see,
Right.
so looking to see what's happening. Perimenopause is challenging because sometimes you're ovulating, sometimes you're not.
Right. Yes. Yes. Well, I got the Aura ring recently, and it has like all those, if you are on your cycle, then it can help check what your temperature is. And I'm
Oh,
sure that would have
neat.
benefited me back then. But if you're not having your cycle, then I think it's a little more difficult you don't have that day 2 to go by or day 20. But what are your thoughts on, I mean, my doctor has said she really prefers to go by how people are feeling. If you're having hot flashes, if you're having trouble sleeping, she will work with you on that and doesn't ask for a blood test. So I'm sure
So
there's so many ways you can do this. But yeah, I'd love to hear your thoughts on that.
yeah, because I look at safety, I want to see
Hmm.
what's going on. Is it the thyroid? We need to look at thyroid antibodies. We
Yeah.
need to look at a full, free thyroid, free T4, free T3 levels. We need to look at homocysteine, methylation, and liver markers, not just in the normal range, but in the optimal range. We need to make sure your vitamin D's optimal
Right.
because when it's low, none of your hormones are working well.
Okay.
And so vitamin D and iodine are necessary for hormones to work, do the job they're supposed to. And, it has been, I try to do, with what's necessary and then every periodically work in the nice to haves. Like I would do
Okay.
total tox testing, functional stool analysis, heavy metal. I mean, there's all different fun things we can do
Wow,
for
you're
sure.
thorough.
For
Yes.
longevity, yeah. I mean, if you're looking for longevity and optimizing quality of life, and I've seen some really sick people, especially post-pandemic with long COVID and infertility diagnosis, and working to reverse all that.
Yep.
It sometimes you've got to dig really deep to
Sure.
do it, and that helps you when you test it and you retest and you see improvements. It helps you stay compliant too.
Yes.
It
Oh,
really
that's
does
so
keep you
interesting.
bought in to, okay, I'm going to keep doing my intermittent fasting because when I stop doing it, my hemoglobin A1C goes up, even though it's the same caloric intake for the day. God help me with that one. I'm built to intermittent
Wow.
fast. That's for sure. I mean, these
Wow.
kind of things are so fascinating to
Okay.
look at. And with that said, I say treat the patient, not the labs.
Sure.
You want to use it as a guide, but
Both. Yeah.
ultimately, how are you doing? How are you
Yes.
feeling? What are some of the symptoms? But hot flashes can be insulin resistance versus estrogen deficiency. And if you're not
Right.
testing, and
Yeah.
FSH, this is another big one that, I didn't realize this for years. Only in the last few years did I see, and I don't know, down some rabbit hole. Thank you, for internet searching and the National Library of Medicine database. Like I'm internet searching and I really wanted to understand different hormone markers. So I was looking at FSH and elevated levels of FSH, which is a follicle stimulating hormone that we really only look as gynecologists on cycle day 2 to make sure it's nice and low below 15 for
Right.
fertility with a healthy
Sure.
estrogen. So we look at that for fertility and then, oh, well, it's high, it's menopause. But it's associated, if we don't work through nutrition and lifestyle and hormonal practices to really drop that FSH, we're increasing our risk for osteoporosis plus brown fat conversion to white fat. So metabolically active fat converting to metabolically inactive fat. And, like yuck. And so as I realized that, I'm like, I'm paying a lot more attention to these markers for, again, longevity.
Goodness. This is all stuff we don't know anything about. At least
And I'm
me.
still
raising my
learning.
hand.
I'm still learning.
Incredible. Wow. Okay, so briefly before, because I know you're a busy woman, I can't keep you all day, but we're talking once you're in that time, menopause itself officially begins. I'm pretty sure I know this. Menopause is when you're 12 months out from your last period, right?
Yes.
But then you're also already called postmenopause. So menopause is
And
kind
exactly.
of a funny word because you're never fully in menopause until you're in postmenopause. But
True.
when you're in that year, or maybe you go 4 months and then you have another period, and then that's what I've done is had these, gaps. Normal symptoms would be, or would you say it's normal to have hot flashes, to have weight gain, brain fog? Are those expected, or is that a sign that there's something else wrong and you can actually treat it?
It's a sign there's something else wrong and you can treat it. It
Okay.
really is. You know what I mean? There's
Wow.
that hormonal deficit, but like you shouldn't, like I said, menopause is mandatory, suffering is optional. And
Okay.
because of my own experience with them, again, as a gynecologist, I didn't learn this in med school or
Right.
residency, but I had to figure it out to help me and my patients. So I went from being diagnosed with early menopause to reversing that, naturally conceiving. And then at age 48, like full blown perimenopause, would have said menopause if it, at 12 months I had another period. And that's where I learned, and I was regular. I cycled regularly until age 50, almost age 56, where age 56, I was finally postmenopausal. And so like that's ovarian regeneration. And what I recognized, okay, that hot flash, was it that glass of wine? Was it too much stress that day? Was I alkaline enough? Did I exercise? Where was my mental health? And then of course, balancing hormones, because we can do all that. And sometimes we still need a little bit of estrogen, a little bit of bioidentical progesterone on board to help us with that level, but to listen to that and see like the aches and pains, we don't have to have those. We need to be aware that those are symptoms that are indicating something.
But we don't have to suffer. So maybe that would be one of my last questions would be, when do you think finding some form of estrogen is helpful or necessary? And could you explain the difference between this bioidentical hormone with just normal, what we've called hormone replacement therapy?
Yeah. So when we use hormones in in the functional and integrative space, we use bioidentical. There are synthetic hormones, which was studied. The Premarin Provera is the most well-known. Prem Pro was most well-known, and that was used in the HERS trial and the Women's Health Initiative study published in 2002, and then the 20-year follow-up in 2022. So the Provera is a synthetic progestin. And what we know from research that, Fournier did an 88,000 person study that in France called the EPIC trial. And he looked at bioidentical micronized progesterone, such as like prometrium, and different forms, medroxyprogesterone, norethindrone, different forms of progestins. And he found that bioidentical progesterone doesn't increase risk of blood clots, doesn't increase risk of breast cancer, is brain protective and bone protective. And so very, very safe. But what he found with medroxyprogesterone, that it had a 4 times increased risk of breast cancer in those
Really?
clients. So yeah, the odds ratio was 4.2, I think.
Okay.
And so there was and same with the other synthetic. So there's what's bioidentical to us, and there's different ways: oral, transdermal, vaginal, ways to use topical. I use a lot of topical progesterone and pregnenolone. I love the combination. It's in my balance cream. It's good for mood, memory, sleep, and skin. So I
Mm-hmm.
like that
Right.
combination. And
Yes.
so, using it that way. And if you're having difficulty sleeping, bioidentical oral progesterone helps you get that good night's sleep. And that's typically 100 to 200 milligrams at night. It depends. And then use it like you should. Again, we want to support your body. So if we're using hormones, I definitely want you to be doing the nutrition and lifestyle factors and
Sure.
supporting detox, adding additional supplements, herbs, etc., to help you with detoxification, then adding in that estrogen. And depending on age, risk factor, before 50, 55, you can do, if there's no risk, no inflammation, no risk of cardiovascular disease, no obesity, then you can do oral estrogens. But otherwise, transdermal or vaginal or creams, topical,
Yep.
compounded, work very, very well. And then, if optimizing as needed testosterone and DHEA. So
Okay, that's good.
there's
And
different things we can do.
yes, and progesterone is the one that really helps with the sleep, right?
Yes.
Yes. So take that before bed if it's an oral progesterone. And otherwise, like you said, you can also use it in creams and that sort of thing.
Yeah,
Wow, this is a lot.
I
And
know.
probably some people are like, you're like my husband. You just throw out these words. I'm like, how do you remember so many big medical terms? But you obviously have a lot up there is in your brain that you can remember. I'm impressed. But there is so much more on your podcast and in your books. You've written things down, put them where people can find them. So we will point to all of that. I did put a question out on my Instagram asking if people had any questions specifically for you today as we were going to be having this conversation. I want to make sure I didn't miss any because they're right here in front of me. So let me see if there's any last questions. The main thing that people wanted to know, you've already touched on, is how do we know if our hormones are out of balance? And if I'm saying it right, I would say you're going to know it because you're feeling off, right? Whether it's mood, hot flashes, weight gain, those things are not expected. They shouldn't be normal. You actually can go through menopause without suffering, right?
Yes,
So
absolutely.
if those things are off, then you want to do something about it. Don't live with it. Okay. And somebody asked, what's the earliest it can start? You started, that wasn't a healthy, normal menopause when you're in your 30s, right? That shouldn't be
Mm.
happening.
No, and I've seen clients diagnosed with early menopause, premature ovarian failure in their 20s and 30s. And so you
Wow.
need to look at autoimmune issues with that.
Mhm.
I mean, something's causing that. Our
Right.
ovaries are designed to continue to function, through age 50.
Okay.
So what's happening? And that's when we have to really dig.
Okay. And then if there's a quick answer to this, and there may not be, but advice on managing PCOS.
Okay, so definitely follow keto-greens 16 for
Okay.
PCOS. I mean, that was, you go to my Instagram at the Girlfriend Doctor, you'll see a age 39 picture and age 56. I got to update it to my current
Right.
58.
That's
But it
incredible.
is, but you can see that that's classic PCOS. Know a little bit about this because,
Right.
but it is, when you have PCOS, first and foremost, those are powerful genetics. Those are survival genetics. You're going to build muscle. You're a leader. You're sharp. You can focus in. I mean, you've got the genetics that are, I mean, those are leadership genetics. I want women to hear that if they've been diagnosed with PCOS, because otherwise we hear we have acne genes, fat genes, infertility genes.
Ooh.
And that's not true.
No.
That's the environment that does that. So switching and, follow the principles, read the hormone fix, follow keto-greens 16. That will really help with nutrition, lifestyle, and understanding. We're very, understanding the multiple aspects that you can do to reverse that very quickly.
Okay. And then last question, because this was personal to me as well, so I'm leaning into it, is a couple people asked about migraines during perimenopause. That's something I've definitely suffered. Any tips on that?
Yeah, definitely. So gluten-free, dairy-free, avoid food triggers. You got to clean that up. I know it's like the last thing you want to hear, but you do. The other thing is sometimes, depending on if it's estrogen related or progesterone, using progesterone the second half of the cycle. So in the luteal phase, 7 to 10 days, or even 14 days before your period starts, but definitely that 7 to 10 days, and or adding an estrogen patch, even a 25 or 37.5 microgram patch when your period starts, or the day it's going to start. So those two combination plus magnesium, can't forget magnesium, and
Yep.
your B vitamins and vitamin B2. Do you have migraines? Vitamin B2, like 100 milligrams a day, will also help prevent migraines. And at the onset of one, take B2, like 200 milligrams, even, I mean, a really good dose every couple hours, and that'll knock that really does go a long way. But you also got to
Oh,
look at the gut. There's
okay.
something, yeah, there's between
Okay.
hormones, gut, there's, many reasons sometimes, but that's kind of, I hope that
Everything's
helps.
connected. Everything's connected. No, that's super interesting. I never could find a connection to what I was eating with my migraines, but I do find that I'm getting them less as I'm getting further from my period. So there's got to be something hormonal there. I'm not sure. So, wow. Well, Dr. Anna, thank you so much for all of this. I was just jotting notes the whole time, but hopefully people can also just hunt you down and find more from you. You are the girlfriend doctor on your podcast, and tell people where else they can find you and what you've got for them.
Yeah, thank you. So definitely come see me at dranna.com. I have a free program called A Breeze Through Menopause, the Keto Green Way. It's 10 days, tiny micro lessons, videos, completely free, with recipes and some of the methods behind my madness. That's a quick introduction to my philosophy. So definitely join that. You can get that for free. So at dranna.com. Thank you.
Awesome. You bet. And I'll be linking to your podcast and you on social media and all the rest. But I just have to say, I mean, I know you've got lots of clients who have walked through this, who have great testimonials, but I think you yourself are such a poster child for everything you talk about, because you look more beautiful all the time. So I'm so blown away
Aw,
by
thank
your
you.
story. Yeah. Yeah. Well, it's been fun talking to you, and I just appreciate you taking the time. So thanks so much.
Thank you.
Aloha. All right, friends, I hope you enjoyed that conversation. And again, you will find all of those notes that Dr. Anna mentioned and everything else in show notes, which you can find at monicaswanson.com/girlfriend-doctor. Okay, and this is just the beginning of a full month of women's wellness topics. So just a little sneak preview. What do we got? We're going to talk about supplements, including some of those you hear a lot in connection with women's wellness, things like creatine and protein and other gut healthy supplements. We're going to talk about fitness trackers. Anybody wearing your Fitbit or your Aura ring like I have? Well, we're going to talk with a runner expert about fitness trackers. A couple other good topics coming up, but I will save those for another time. So definitely keep coming back. Spread the word about this month on the podcast. And just thanks for being here. I appreciate you guys so much. And as always, I do appreciate you leaving ratings and reviews if you haven't yet. So easy to do that. Just scroll right down on your phone now as we wrap up. It's a great time to do it. Find those 5 stars, click on them. And if you have a moment, I'd love for you to leave a few words about what you love most about the podcast. And just so you know, I do pick as often as I remember to, once a month, I pick somebody who's left a rating or review. I read it here on the podcast, and then I send you a little Starbucks card as a thank you. So leave one, and you might be the recipient of a Starbucks drink in the future. Okay, thanks guys so much for being here. God bless you. Have a wonderful rest of your week. And until next time, aloha.